Okay, Protocol 52 is our OBGYN childbirth, labor, and delivery protocol. No real change from your current protocols. There is an APGAR scale in this protocol for your reference, as well as a depiction of the knee to chest position for the prolapse cord or shoulder dystocia or limb presentation pregnant female. Protocol 53 is our pregnancy-related emergencies protocol, which is broken down into 4 different categories: seizures, hypertension, hypotension, and labor. For our advanced providers, in the instance of hypotension and pregnancy, you're to start with normal saline boluses at 500 mLs IV or IO. Repeat to the effect of a systolic blood pressure 90 millimeters of mercury or greater, and you can give up to 2 liters. Of course, we want to reassess for fluid overload. For all pregnant patients that we think there may be some sort of emergency, we want to do a blood glucose analysis. All right, so for labor, of course, you're going to exit the childbirth, labor, and delivery protocol, Protocol 52. And our advanced providers in the instance of hypotension and pregnancy, again, fluid resuscitation. Protocol 54 is our WMD ChemPack protocol, and this protocol is for WMD use only, or weapons of mass destruction only, and providers are only to perform skills in which they have been trained. This protocol deals specifically with organophosphate poisoning, and what this will cause to the patient is an acronym known as SLUDGEM. It stands for salivation, lacrimation, urination, defecation, diarrhea, GI upset, emesis, and muscle twitching. Now, the medications we'll give in this come in the form of an auto-injector, and it's 2 medications, atropine and prolixidine. Now, in the protocol, it states that we use the Duodote kit, which is both medications mixed in 1 auto-injector, but we may also get separate auto-injectors per the medication. All right, so the dose for atropine is 2 milligrams IV, IO, IM, and prolixidine, or 2-PAM, 600 milligrams IV, IO, IM. Now, of course, if these are in auto-injectors, we will be giving this IM. Okay, so that's it for the specific protocols, all 54 of them. Now we're at the procedures section. I'm just going to read this disclaimer to you again. Procedures may only be performed as trained, authorized by an OMD, and in accordance with the Virginia Scope of Practice maximums. The procedures listed here contain general instruction and protocols for their implementation. If using equipment not listed here or in the event of conflicting instruction, follow the manufacturer's suggested settings and/or procedures. Okay, I'm just going to take this opportunity now. I'm not going to list all of these procedures, but I'm going to talk to you about your skills training that you are going to complete once you complete this module. We are training members of your company to be instructors in the skills portion of this protocol rollout. For our EMT and our advanced providers, you will be trained on 12-lead ECG placement and how to control the LifePak 15, what buttons you need to push. You're also going to be trained on CPAP administration and how to use the inline nebulizer connected to the CPAP. Also, what pressures, what settings. You're going to be trained on capnography, how to place the nasal cannula in tidal CO2, capno line, and a few things about what the numbers mean, an increased EtCO2 or a decreased EtCO2. You're going to be trained on the PET oxygen mask and how to use that. You're going to be trained on taser probe removal. We're going to talk about the new tourniquets, the CAT tourniquet, how to use that. For our advanced providers, you're going to get training on the mucosal atomization device, or the MAD device. This is how you give medications intranasally. And you're also going to receive training on the interosseous access, or the EZ-IO. All right, the policy section. Again, this is your responsibility. You need to become very familiar with this policy section. It's going to help you answer a lot of questions when treating a patient here in Fauquier County. And this is the table of contents for the policy section. Again, this is your responsibility to become familiar with all policies within these protocols. Medication reference. We talked about this during the introduction module as well. Every medication that we carry in Fauquier County is referenced. The color-coded medication reference, the Broslow tape reference here. I have circled here the average weight. This is not on the actual Broslow tape, an average. So I just want to point this out that all these drug dosages are corresponding to that average weight. Okay, in our EMS resources section, you have the phone numbers and contact information for the Critical Incident Stress Debriefing, the Virginia Office of EMS, Adult Protective Services, Child Protective Services, Chemtrek contact information for our hazmat situations, medical examiner, and poison control. You also have the addresses and contacts for area hospitals. There is a dopamine drip rate, an IV drip rate, a chart on mixing D25 and D10, and an APGAR score. All right. You also have the GCS Adult, GCS Pediatric. You have the trauma score. You have the field trauma triage, the field stroke triage decision scheme, the rule of nines, adult and pediatric, and the start triage and jump start triage. Okay, this concludes Module 2 of the 2014 Medical Treatment Protocol Training. Once again, thank you for attending this training, and your next and last step is to attend your skills training. Please keep in mind the certificates you received from Module 1 and Module 2, you must take to your skills training. That needs to go in a packet with your skills checkoff sheet, and that's how we can verify that you completed all aspects of the training. Again, thank you and have a good day.